I'm currently stationed at Fort Belvoir Community Hospital, and I also recently spent time at Walter Reed Hospital here in the National Capital Region. I have served as an inpatient oncology nurse and also as the survivorship program coordinator here at Fort Belvoir to take care of our patients who have completed treatment. What we actually see on the floor and in our nursing practice, it's a really beautiful system because if you're active duty or you are a full retiree, you are covered by TRICARE. That sort of encompasses your entire treatment course. You know, when you're talking about cancer care, it really impacts every piece of your life. And, you know, depending on the type of diagnosis, specifically for prostate cancer, you know, the treatments vary, and depending on what point in your disease progression you're diagnosed, your treatments are really, you have a lot of options. I think sort of the biggest concerns is how is it going to impact my daily life? Can I continue with activity levels that I've been continuing with? How is it going to impact my sex life? You know, all of these different concerns for men that have been leading, you know, a very active lifestyle that is characteristic of men who have served in the military. One of the things that I love most about nursing, we are the patient's advocate. We are your front line. We get so much more time with the patients than the doctors do. At no fault to the doctors, it's just the way the system is set up. I think the beauty of the nursing patient relationship is having that opportunity to ask the nurse any questions that you have, and potentially questions that you don't necessarily feel comfortable asking a physician, whether you feel like you're wasting their time or it's not something that's within their area of expertise. I think the physicians, they provide a lot of information, and they provide sort of the cold hard facts. What are your blood levels? What are your, you know, what's your PSA level? What are the sort of what's the science that's there? And I think the nurses are able to sort of interpret that science into language that helps patients understand how that science is going to impact their life day to day. We're also going to ask a lot more about just the patient's well-being, which seems sort of a little bit more touchy-feely than I think a typical conversation with a doctor would be, because we get down to a lot of details about patients' concerns by finding out how they're feeling about their diagnosis, how they're feeling about the treatment that they're undergoing, and really help to uncover some of those resources that they potentially didn't even know they needed. I can be in a room hanging fluids for a patient, or, you know, even bringing them their breakfast, anything like that. And while I'm in there, I have the opportunity to talk to them about their family, about, you know, what was the last vacation they went on, some of those more personal details that really, I think, build rapport and help us get to know one another. I'm able to share about myself as well. And I think having that back and forth communication helps people feel a little bit more comfortable. I think also we have that added time, and we have the ability to bring up issues that we know are common for different diagnoses. And so being able to sort of bring up those issues in a more conversational manner, you start talking about what other areas they've served in, what was their favorite duty station, you know, where were they born, where did they grow up, what made them want to join the service in the first place. We have patients who have served overseas, who have been deployed, who have just had these intense experiences. I think a lot of times they are very hard on themselves when it comes to cancer treatment, and sort of the feelings of fatigue and fear that are associated with cancer. Because I think that in their mind, it's this thought of, well, I have been shot at, I have gone through all of these more challenging experiences and sort of more dangerous experiences. And so they sort of belittle the cancer experience in a way. We'd have, for a lot of our active duty patients, we'll have survivors come in and, you know, they'll come in their uniform, they're still on active duty, and show folks that they can get through this treatment and they can come out on the other side with a quality of life that is as good as, or sometimes better than what they went in with. We have younger folks come in who were exposed to burn pits and some of those other, you know, theater areas. And it's a lot. I think that we see more and more here at, you know, Belvoir and at Walter Reed. We have really robust occupational health programs. And I know there is a lot more focus on that in the military than maybe there was years and years ago. But I think there definitely is that concern for folks that are coming in from overseas, like what, you know, led to them being diagnosed. And unfortunately, a lot of times we don't know, except in the cases of, you know, like those individuals who are exposed to Agent Orange or other identified agents. I had a patient, it's been about 2 years now, who was in sort of an advanced stage of their disease progression and didn't feel like they could express in words in real time to their spouse how grateful they were for everything their spouse provided for them and the attention that they gave them and just the care that they had, the life that they had shared with them over the years. I think in those instances, as a nurse, you are there just to hold their hand. And in that case, it was holding their hand with one hand and writing a letter for them with the other hand. And having the patient tell me exactly what they wanted to say to their spouse and being able to write that letter and hand it off to their spouse to make sure that they were represented the way that they wanted to be.